Hello, my name is Lisa Stavrakas with Renew Wellness, and I am here to share with you my 3-series presentation on the holistic approach to Alzheimer's. My mother was diagnosed with Alzheimer's back in 2010, and watching her progression until she passed away in June of 2019 was so hopeless feeling until April of 2018 when I met Michael Morgan in my first CranioSacral Therapy training. In the meantime, I had been researching brain health and holistic approaches with my massage background, my yogic background, and digestive wellness coaching. And when I went to my first training, Michael Morgan stood up and he said, "Hi, my name is Michael Morgan, and I have the cure, reversal, and prevention of Alzheimer's." And I just thought to myself, well, who are you? Right? It was such a hopeless feeling in our family. And then as I listened to the craniosacral training and Michael's specific approach to Alzheimer's, I began to believe that there was something to this modality. Several weeks later, I went home and started treating my mom. I was there for 4 or 5 days and treated her every day. And one day she said my dad's name for the first time, and she had not spoken his name for years. And my sister-in-law and I looked at each other like, coincidental? I don't know. It was a beautiful moment. So today we're going to talk about where we've been and some different approaches. So I'm going to share my screen with you. Got a lot open, forgive me. There we go. So our history. In the 1950s and 60s, we referred to cognitive impairment as senile. And then the term Alzheimer's disease was coined in 1910 by a German psychiatrist and neuropathologist, Alois Alzheimer, who in the early 90s identified, diagnosed, and described the disease after working with and doing a post-mortem autopsy on a patient. He found progressive degenerative disease of the brain, a form of dementia whose major symptoms are short and long-term memory, confusion, mood swings, aggression, and loss of bodily function. Let me back up and say post-mortem autopsy. So we really don't know if somebody has Alzheimer's until they've passed away and we do an autopsy. I still, to this day, am not sure why we keep referring to Alzheimer's as Alzheimer's when people are still alive. In 1977, the term then became senile dementia of the Alzheimer's type. And by the 1990s, the public was becoming more and more aware of Alzheimer's and dementia. Presently, Alzheimer's remains incurable, and an estimated of 6.9 million Americans aged 65 and older are living with Alzheimer's. It is the 6th leading cause of death in the United States. And this, by death, I mean this is what they died of. My mother truly died of Alzheimer's. She did not have any other comorbidities. Heart disease is still the #1 death, and diabetes is 7th. And let me say this, type 2 diabetes can be reversed. And they're also, you've probably heard about Alzheimer's being called like type 3 diabetes because there is a link. Michael Morgan, the gentleman that I referred to that was my craniosacral therapist, wrote a book called Longevity Prescription about 10 years ago. And here is his book. And one of the quotes out of his book says this: as for future projections, ADI's World Alzheimer's Report in 2013 predicted that by 2050, which we're not that far away, Alzheimer's will affect up to 16 million seniors in the US and 115 million worldwide, reflecting a significant global health concern. On the very simplistic of simplistic definitions, Alzheimer's is basically plaques and tangles that are typically discovered during autopsies of those who have passed away from the disease. Most researchers will agree that part of the mechanism of their formation comes from amyloid precursor proteins that are broken down, as evidenced by the existence of enzymes and called beta gamma proteins that get embedded in the brain. And now I'd like to share with you Jeffrey Iliff's presentation. Jeffrey is from Rochester University. And this is out of Michael Morgan's website if you want to go see it for yourself. So here is Jeffrey's presentation.
The brain's highly metabolically active. The brain cares an awful lot about what its environment is like. If it's off just a little tiny bit, it stops functioning properly. We showed that the CSF goes into the brain just like people thought before, but it actually does.
Let me back this up. Here we go.
The brain's highly metabolically active. The brain cares an awful lot about what its environment is like. If it's off just a little tiny bit, it stops functioning properly. We showed that the CSF goes into the brain just like people thought before, but it actually does so along very specific anatomical structures. There's a specialized anatomy that allows the CSF to move very quickly and very deep into the brain, exchanging with the fluid that's inside the brain and then moving out. So it's a much more efficient system for clearing the fluid and the waste out of the brain. We injected fluorescent tracer into the CSF, or the fluid that surrounds the brain, and watched to see where it went. The fluid, as it moves down the artery, is able to move right into the brain tissue. As it moves into the brain tissue, eventually, if you look long enough, where it collects is at the other end, at veins, which are another part of the circulation. Once it reaches those veins, it's able to drain out of the brain along the outside of the veins. As the fluid sort of courses between those two, in along the arteries, through the tissue, out along the veins, that continuous flow sweeps along particles that are sitting in between the cells. Amyloid beta is a protein that is made and secreted from cells in your brain all the time. In Alzheimer's disease, one of the things that happens is amyloid beta builds up in the brain and clogs up the space in between the cells. And it's thought that that's what kills the neurons and causes the dementia that's the hallmark of Alzheimer's disease. So when we first found this system and found that it was clearing extracellular solutes, we said, well, what solutes might be of interest that might be being cleared by this? And when you think about extracellular solutes that the brain wants to get rid of and needs to get rid of, the first thing that comes to almost everyone's mind is amyloid beta. So that was pretty much the first thing we tried, was to find out whether amyloid beta that's between the cells is cleared along this pathway. One thing that could be happening in Alzheimer's disease is this pathway is failing. So if because you're aging, this pathway stops working properly, or because you suffer an injury or an infection at some point in your life, maybe this pathway stops working properly, and that ends up causing the deposition and the accumulation of amyloid. For treatment, it suggests that you could slow the process of amyloid deposition, perhaps by speeding the system up and sort of flushing the brain out and getting rid of the amyloid before it accumulates. And if you had, a brain that had a bunch of amyloid that had already accumulated in it, perhaps you might be able to flush that away or wear away those accumulations with a higher rate of flow. So we may be able to try to modulate or change how this system functions to try to clear it more quickly.
So a couple of things I want to say about Jeffrey's presentation is when he talked about injury, brain injury. And with that being said, I am always saddened by people that I hear of who've been in a car accident or banged their head skiing or mountain biking or whatever, and the doctors are like, we did a CT scan, no worries. And yet there is trauma that has happened. And craniosacral therapy is, again, a technique that we highly recommend if you've had any kind of brain injury, whether you were knocked out or not. And usually we say that, oh, it's okay, you didn't lose consciousness. Well, it doesn't matter, you hit your head. The other thing that I'll share with you in a few minutes is Michael Morgan's presentation on craniosacral therapy, doing just what Jeffrey was talking about, is that flushing out of the brain. But here, I'm sharing with you what a healthy brain looks like. And then down at the bottom, you see the healthy neurons. And then on the right side of your screen, you see the Alzheimer's brain and the plaques and tangles and the diseased neuron that are not healthy looking. And you notice that the brain has condensed, it's more shrunk, and looks more dried out. And again, that's where we bring in more cerebral spinal fluid when we do craniosacral therapy. So I want to describe to you what evidence-based is, because craniosacral therapy in a lot of these more holistic modalities that are being done out there are kind evidence-based. And so the term evidence-based came from Dr. David Sackett. And it's this: the consciousness, explicit and judicious use of current best evidence in making decisions about the care of the individual patient. It is the integration of clinical expertise, patient values, and the best research evidence into the decision-making process for the patient. It's the clinical expertise refers to the clinician's cumulated experience, education, and clinical skills. It's also what the patient or client, in my case, brings to the encounter of his or own personal preferences and unique concerns, expectation, and values. Each one of us brings to the table something different. And I believe that that is why this is not a disease of a one size fits all or one pill fits all. The best research evidence is usually found in clinically relevant research that has been conducted using sound methodology. This screen here is from the CDC, and they have that same definition of evidence-based practice. It's the clinical experience, the best research evidence, and then the patient values and preferences. So there's a lot of current research being done out there. Some of the individuals that I have been following for years, Dr. Perlmutter, he is a board-certified neurologist and 6-time New York bestseller. He has written the book Grain Brain, which is where they started looking at the combination of carbs and wheat and sugar, again, sugar being that connection of diabetes and that type 3 diabetes that Alzheimer's is being cloned as. He has also written Brain Maker. He has co-written Brain Wash. And he's looking at the microbiome and the brain, as well as uric acid and metabolic disease. One of the quotes that came from him in a recent podcast that I listened to was this: instead of a person suffering from a drug deficiency, let's define deficiencies that are unique to the individual. Let's use a multimodality approach instead of a pill. Another neuroscientist that I follow is Dr. Carolyn Leaf. She wrote the book Think and Eat Yourself Smart and Switch on Your Brain. Dr. Carolyn Leaf talks about the mental emotional component of our brains and how that impacts our emotional thought life. So negative toxic thinking is like a burnt up Christmas tree. And then positive thinking is more like that Christmas tree with all the glittery, sparkly lights and everything's firing. And so she really talks about not only eating for your brain, but also how your mental emotional life can impact your brain. Most recently, I listened to a podcast from Dr. Lisa Mosconi. She is an Italian neuroscientist who talked about menopause, hormone health, and Alzheimer's prevention. And I found this study to be quite interesting. In 1994, there was a study done that showed that Alzheimer's impacts women more than men. 2/3 of all Alzheimer patients are women. Ages of a woman's brain during mid-age from about 35 to 65 showed that the neurons were just not firing as well. And we laugh and we talk about, oh, I just can't remember, I'm going through menopause, I have my brain fog. And there's really a lot to be said to that because of our changes in our hormone. However, she also indicated that genetic mutation was found in only 2 to 3% of all Alzheimer's cases, meaning that the vast majority of people with Alzheimer's had other risk factors. She went on to say that 20 to 50% of all Alzheimer's cases may be due to lifestyle, which I will be talking about in the next other 2 series, and medical conditions rather than genetic conditions. And then we have Ari Witten, who is a human nutrition and functional medicine provider. He is the founder of Energy Blueprint, and he is looking at breath work, which if you think about it, when we breathe appropriately, which the majority of us do not breathe properly, breathing through our nose and truly oxygenating our blood cells also allows for oxygenation of the brain, which is why if you look at something like sleep apnea, where a person stops breathing while they're sleeping, and then they say that this impacts the brain, and it also is worse than driving drunk. Driving when you haven't gotten enough sleep is worse than driving drunk. It is because our brains are not getting oxygenated. Sleep is so critical, which again, I'll be talking about in the next 2 sessions. And then we have Michael Morgan. He is the founder of Body Energy Longevity Prescription, and his website is preventingalzheimers.com. And so now I would like to share with you Michael's presentation, which dovetails off of Jeffrey's. This is on Michael's website as well.
Hello, my name is Michael Morgan, and I'd like to welcome you to CranioSacral Therapy for Longevity, background research, and resources for prevention and treatment. And in this brief presentation, we're going to talk a bit about what is craniosacral therapy, some of the benefits, some of the research, the general benefits for the general population, and how it applies to the senior population specifically, and to the prevention for Alzheimer's dementia, and give you a brief outline of how to follow up for some resources for further education in your setting. So the first thing, what is craniosacral therapy? We can describe craniosacral therapy as a gentle hands-on light touch technique that allows the mind and body to settle down, rest, and rejuvenate. And one of the key features of craniosacral therapy that I like to mention is that it's very gentle, very non-invasive. It can be used on infants, children, the population of all ages, and especially seniors. And because it's so gentle, it's really, I think, one of the perfect techniques to really work with a population that might be a little more at risk and a bit more fragile. Craniosacral therapy was developed by osteopath Dr. John Upledger in the early 1970s. Dr. Upledger studied in Kirksville, Missouri, and he followed in the footsteps of pioneering researchers such as older osteopaths by the name of A.T. Still and William Sutherland, who really developed from the 1890s onward this osteopathic technique. A.T. Still founded the Kirksville College of Osteopathic Medicine in 1893, and there was really the feeling in the time that he started his pioneering work that osteopathy is a very gentle, light hands, light touch technique, could really recruit the inner resources of the body. There was a feeling at the time that the body had its own natural pharmacy, and if recruited and listened to, the body could start to realign and heal itself. So it's on that basis of the osteopathic tradition, which many say chiropractic grew out of that, and Dr. William Sutherland that developed cranial osteopathy, the Dr. Upledger developed this modern form of craniosacral therapy. And since the formation of the Upledger Institute in 1985, we have trained over 100,000 therapists worldwide. Nowadays, when you hear craniosacral therapy, even from the last 5 to 10 years, it's really known as a technique that's recognized and has been out there for people to look at because of its applicability to many different areas of treatment that we'll mention briefly in this presentation. Now, how does craniosacral therapy work? It allows the core nervous system to reset itself. I kind of joke that craniosacral therapy is like hitting that red reset button on that water heater or the furnace to get a reset. And in many ways, craniosacral therapy, because it works at such a core level of the body, it allows that transformation and resetting to occur. Part of this is achieved by increasing fluid flow on all levels, whether it be blood or cerebrospinal fluid or water or interstitial fluid in the body and brain, which has a very positive and beneficial effect because it can result in improving vitality in the body, helps improve memory and cognition in the brain. And in this next slide, we see an overview of the craniosacral system. On the left, we see here at the top, of course, the head, which is really ensheathed by a meningeal system, which is only a few millimeters thick. It's right underneath the bone in the head, and it encases the brain tissue itself. And it's within this very thin sheath that the cerebrospinal fluid flows. And then the head, of course, connects to the spine and comes all the way down to the sacrum. And the craniosacral system is named for the cranium at the head, the sacrum at the sacrum, and in between this dural tube, D-U-R-A-L, dural tube that ensheathes the spinal cord. And of course, that dural tube is surrounded by the bone itself to help protect it. And Dr. Upledger, in his pioneering work, really helped define the craniosacral system as a fundamental system in the body, as a body system, as fundamental as the respiratory or cardiac or nervous system. And he started to look at the interplay of all these systems and how craniosacral therapy and the craniosacral system at the core can help underlie and influence all these other systems as well. And that image on the right, the brain and meninges in the spinal cord, gives you an idea of how that very thin covering of the meningeal system really encheises the brain, all parts of the brain, and helps bring nurturing cerebral spinal fluid to the brain itself at the core, helps prevent the brain from injury, and helps remove waste products. And the drawing in the middle, the lateral aspect of the skull gives you an overview of the plates of the skull itself and how craniosacral therapists are trained to very gently blend with these different aspects of the skull to get some beneficial changes as they apply their therapeutic techniques. Now, some of the benefits of craniosacral therapy across the board. Over 30 years, we've noticed the following benefits in the general population. It helps with headaches and migraines, really a crowd pleaser with many, many people. We've got some very good results with that. It helps with lower back pain. Not all the time, but in a wide variety of cases, we found some very, very beneficial effects in treating lower back pain. Immune system disorders. Dr. Upledger was a pioneer in looking at inflammation as the cause of a lot of immune system orders, or a byproduct of that, really strictly speaking. Long before the idea of inflammation became popular, Dr. Upledger was speaking about that with his mentors and speaking about the effects. So we've had some very good effects in treating people with immune system disorders of many, many types that often can be very puzzling, that craniosacral therapists with specialized training can help address. Pediatrics, with infants and children, especially children that have autism or cerebral palsy, or sensory integration disorders, any variety of issues like this. We've had some pretty good success with pediatrics, and it was in my study of pediatrics and working in infants and children that I realized that craniosacral therapy could be applicable to the senior population, because of course when you have both ends of the age spectrum, you have a bit more of a vulnerable population, and that led me to really see that craniosacral therapy could be helpful for seniors as well. Post-traumatic stress disorder. We've worked with Vietnam vets, Afghan vets, vets that have been in Iraq, and we've had some pretty good results, allowing a lot of that deep-rooted trauma that's been encased in the brain and central nervous system to be released in a very safe way. And it seems that these vets and soldiers that have worked with therapists have actually begun to be able to bond with them and feel very safe. So it's a very non-invasive way to work with some fairly challenging situations. And really, in a sense, as an aspect of post-traumatic stress, we've been working more and more with professional athletes and brain concussion. We've been doing some studies with NFL players. And the reason I got drawn into assisting in that specialized area is that I realized the brain scans of many NFL players looked a lot like the brain scans of people with Alzheimer's dementia. And I began to think, if we could demonstrate a positive change, which we're starting to see in professional athletes, perhaps then that could also be of assistance to those that did not have as much celebrity, but definitely had memory challenges, like the 5 million people plus that are diagnosed with Alzheimer's dementia in the United States today. How can craniosacral therapy also help with dementia and Alzheimer's, based on what we've just discussed? Well, there was a research study that was conducted, and the results were printed in the Journal of Gerontological Nursing in 2008. And the title of the study that I helped coordinate as a consultant was called Craniosacral Therapy Still Point Technique, Exploring Its Effects with Individuals with Dementia. Now, a summary of the research study. It was a study funded in part by the National Institute of Health, really only a few $1,000s, but that funding helped fund the therapists that applied the technique and help with the analysis of statistics and some of the structural aspects of the study. It was basically a 6-week study on folks in nursing homes that had moderate to severe Alzheimer's. And basically the design of the study was to administer a craniosacral therapy still point for 5 to 10 minutes a day for 6 weeks at the same time every day. And part of the design of the study was to really look at behavior and agitation. Of course, as you know, in nursing homes, agitation can be a big factor in terms of taking resources of staff and administrators to deal with that. Drug treatment has, of course, been one option in the past. And we looked to see if we could actually help reduce agitation in that population. And we also looked at the baseline evaluation. We did a before, during, and after evaluation. We looked at memory, cognition, and evaluated a study to look and evaluate the effectiveness of the technique. Now, the results of the study, we saw that we achieved clinical and statistical significance, not just by chance. We saw that there was a change from before, during, and after the intervention of the still point technique. We found a reduction of all categories, meaning neurologically, behaviorally, and otherwise. Then across the board, we found some changes that we could document. And these changes continued in the post-intervention stages, meaning that even after we stopped applying the still point for some weeks thereafter, those changes began to, were shown to linger. And noticed by certified nursing staff and family members, they also noticed the change. Just as one anecdotal point, clients began to recognize their caregivers and relatives. We had 100-year-old lady in a nursing home in Minneapolis that began to be able to speak in complete sentences and feed herself. So we thought we had documented some significant changes as we went through the study. Now, we can ask what causes these changes, some of the theory, which would explain some of the changes that we saw and observed. Part of the theory is that craniosacral therapy affects the flow of cerebral spinal fluid within the body and the brain itself. Now, normal adults have a daily turnover of anywhere from 600 to 800, depending on who you read in the literature, milliliters of cerebral spinal fluid in their systems. And Dr. Upledger began to notice as we age, middle-aged adults have reduced turnover of CSF. Of course, what does it mean middle-aged? That could be 40, 50, 60 years old or more these days. But we noticed that in many cases, middle-aged adults have reduced turnover of CSF, sometimes as much as half the normal amount of that 600, 800 milliliters a day. And my nursing homes, my nursing friends that helped me research this found that patients with senile dementia may have a turnover of 75% less than a normal adult, or as little as 200 milliliters a day. So it's a significant reduction from normal turnover of cerebral spinal fluid. So there's an opportunity for change here in terms of treatment, prevention, and the craniosacral still point. The idea is that if there's an increase in the volume of cerebral spinal fluid, this will help clear toxins and accumulated restrictions in the brain, including amyloid plaque and neurofibrillary tangles, which are part of the signature symptoms, if you will, when they image the brain. Say that people with Alzheimer's dementia, by the time they have accumulated amyloid plaque and neurofibrillary tangles, that's a pretty good smoking gun and an indication that Alzheimer's and dementia exist in the brain. And the idea is the still point, by increasing that flow of cerebral spinal fluid, helps prevent the formation of harmful toxins, inflammation, and amyloid plaques as we age. Now, the benefits of the still point, which is an easily learned administrated technique that's usually taught over 1 to 2 days, it helps increase blood flow to the brain. It helps increase the flow of cerebral spinal fluid, as we've discussed. It helps increase flexibility of the central nervous system. It helps in the reduction of stress. And of course, we found in seniors have their own form of stress and worry, not to mention anyone in the general population. So it can help reduce stress. It can help stabilize and even lower blood pressure because you're affecting the sympathetic nervous system. If you can get a moderation downward and more of a parasympathetic tone, you're actually allowing the arteries and veins to basically relax. You get more flow of whole blood volume and flow, and hence a reduction in blood pressure. So that's another nice benefit of the still point. It helps decrease cerebral and pulmonary congestion. We find that even middle-aged people in hospitals began to develop cerebral and pulmonary congestion. Still points are a way to decrease that. It helps again remove metabolic waste because there's more increased cerebrospinal fluid flow. It helps again reduce headaches and migraines. And again, it helps remove metallic toxins across the blood-brain barrier, such as aluminum and mercury, and get them out of that blood-brain system. That can complicate cognitive function and cause problems which are not obvious. So it helps flush that out as well. So educational resources for assisted living, nursing homes, and memory care facilities.
So you can see where the combination of what Dr. Jeffrey Iliff discussed and what Michael Morgan recommended in craniosacral therapy, where we see hope. This is where my hope came from. Even though it was too late for my family, it's not too late for others that are out there with this disease. So craniosacral therapy is showing up with greater and greater recorded success in the category affecting our nation by the millions. Patients suffering early to late stage dementia. And yes, it is definitely showing improvement in those diagnosed with the condition. I talk to Michael on a frequent basis and hear his success stories all the time. And then the common thread that we will be talking about in the next two presentations is our gut health and lifestyle, because these things matter. This is why we are having a hard time finding that one size fits all or that pill that cures all, because it's multidimensional, much like most dis-ease in the body is. So thank you so much for joining me on this presentation. If you have any questions, there's my contact information. My phone number is 406-600-7267, or you can email me at lisa@renewwellnessmt.com. Keep in mind that the renew and the wellness share that same W. I look forward to hearing from you, and thanks again. And to all of you who have a loved one that has either suffered from or is going through dementia, Alzheimer's, so much love going out to each one of you. I am here for you. Thanks, and have a great rest of your day.